is Jake Deister. I'm an orthopedic surgeon with Cotton O'Neill Orthopedics and Sports Medicine. My practice is primarily made up of joint replacements, the shoulder, the hip, and the knee. But I also fix most broken bones in pediatric and adult patients, and I do some hand surgery, including carpal tunnel releases, trigger fingers, Dupuytren's contracture, and some elbow procedures. My particular niche within that, though, is a shoulder replacement. So the typical patient is somebody who's got dysfunction in their shoulder. So the things that you could usually do, they're unable to do because their rotator cuff doesn't work. So things like getting a coffee cup out of the cupboard or basic hygiene issues are very difficult because the rotator cuff doesn't work. But when your rotator cuff doesn't work, your shoulder starts to develop arthritis. So now you've got dysfunction and you've got pain. And so what we do for those patients is we do what's called a reverse shoulder replacement, and that takes care of, in one surgery, both the rotator cuff dysfunction and the pain due to the arthritis. I see most of us who are specialists as tools in a big toolbox. It's essentially owned by the family physician who's taking care of this patient and trying to get the best out of this patient. And so when a patient comes and sees me because of their shoulder, hip, or knee pain, I'm rarely just thinking about that one issue. Because when a patient has joint pain that is keeping them up at night, there are other problems that are associated with that. They're tired the next day, and when you're tired the next day, you don't go on your walk after dinner, or you don't play your 9 holes of golf, or whatever it was that kept you active. And when you can't be active and you slow down, your bones get weak, your joints get weak, everything becomes more painful. And then you can develop all sorts of other problems. And so I look at myself as one of the tools that can help alleviate the pain so that the whole person can be taken care of. Because I think inside of all of us, there is a best you that you can be. And if I can be a specialist that can help get each patient closer to that goal, then I've achieved my goal.